The digestive
Camille?
system,
Digestive, very good.
circulatory,
Circulatory. Have some
lymphatic
knowledgeable
system,
people here. Go again.
lymphatic
Please repeat.
system,
didn't hear that.
system,
Lymphatic. Very good.
system,
Very
yes.
good. Thank you. Thank you very much. So we're going to go ahead and talk about the 11 different organ systems. There are the circulatory, digestive, respiratory, nervous, muscular, skeletal, reproductive, urinary, the immune or the lymphatic system, the integumentary system, which is the outermost layer of an animal, and the endocrine system. So those are our 11 organ systems. Now, here we have a diagram showing us some of the organ systems. We have the lungs, which is a part of the respiratory, the heart, which is a part of the circulatory, the liver, spleen, stomach, and pancreas. You can see them all here. The gallbladder, part of the digestive, and the kidneys with the ureters and the bladder who form part of the urinary system. So let us go into more details about each circulatory system. There are 60,000 miles of blood vessels in your body. One drop of blood contains 10,000 white blood cells. That's one drop of blood. One drop contains 10,000 white blood cells and 250,000 platelets. So, can you tell me the major functions of the circulatory system? What does the circulatory system do? It transports nutrients, oxygen, and hormones to the cells throughout the body and removes carbon dioxide and other waste. Sorry about that. I'm going to ask the other question. Camille, can you help me to open the mic for me and tell me what the circulatory system is made of? What makes up the circulatory system? What are the organs involved in the circulatory system? And what you can tell me the organs, not all of them, even if you can tell me one. Can you open up the mics for me,
The heart.
Thank
the
you,
heart.
the heart. And what
Blood.
else?
Blood vessels and capillaries.
The blood vessels and the capillaries are one other type of blood vessels. And what else? And what else can tell me the last one missing? What is missing?
The lungs.
The lungs are part of the respiratory. But
Okay.
I understand why you say that. I understand why you say that. But
Okay.
the next thing that is missing is the blood itself. The
Right,
blood.
right.
Yes. The heart, the blood vessels, and the blood. Now let us take a look at the heart. The heart is the pump of the circulatory system. It contains 4 chambers. And each of these 4 chambers have one-way valves in between them. The top chambers connect to the bottom chambers, and there's a one-way valve. So the blood ought to flow in one direction. When there's something wrong, it can flow back. There can be a backflow. But as you can see the white arrows here, it ought to be flowing in one direction through the one-way valves. And there's a thin covering that covers the outer surface of the heart, and it is called the pericardium. And it's very important for the pericardium to protect the heart while it is beating. Now, we mentioned the capillaries before. Capillaries are a type of blood vessels. There are 3 main types. Arteries, and arteries carry oxygen-rich blood to the body. If you notice the diagram here, we have the arteries showing, and we use the red to signify oxygenated blood. That's what the arteries carry. Veins carry blood from every part of the body back to the heart. You see the vein represented here with blue, meaning that the blood is deoxygenated. Oxygen has been removed from the blood. And the capillaries right now are the small, thin blood vessels that connect the arteries and the veins and allow for the exchange of oxygen, carbon dioxide, nutrients, and waste. Let us look at this diagram right here. Let us start at the lungs. If you notice, the lungs have oxygen. The lungs are where oxygen exchange takes place. So the blood leaves with oxygen towards the heart. And the purpose of the heart, which is represented by this rectangle here, the 4 chambers of the heart represented by this rectangle here, the heart is going to pump the blood to the body. So from the lungs, it goes to the left atrium, from the left atrium to the left ventricle, and from the left ventricle to the rest of the body. Now in the body, the oxygen is used up. And then you can see they change the color from red to blue because we're now talking about deoxygenated blood. So the deoxygenated blood goes back to the heart so that it can be pumped back to the lungs. So it goes to the right atrium, into the right ventricle, which leaves the right ventricle and goes to the lungs, where again the whole process starts over, where the lungs oxygenate the blood to pump it around. So that happens several times, more than 20,000 times during the day in this body that God made so wonderfully for us. So the blood is composed of plasma and blood cells. Plasma and blood cells. So plasma is mostly water. It contains nutrients, proteins, hormones, and waste. Now the blood cells, red blood cells, carry oxygen. They contain hemoglobin and they last approximately 120 days. White blood cells are the ones that fight infections. They live for about 1 day. So the white blood cell count can change dramatically from 1 day to the next. While platelets help the blood to clot and they live for approximately 9 days. Look at the diagram here. It's very important the shape of the red blood cells has. It is a biconcave disc, meaning that both sides, you see that sinking in the middle there? It is on both sides. It's a disc, not a discus shape, disc shape. And the platelets are just like fragments, and you see the white blood cells, you can tell there's a lot of activity going on in the white blood cells because they're the fighter cells of the body. Now, let us go into the bit of pathology, what goes wrong. The effects of high blood pressure on the circulatory system. High blood pressure is a sign that the heart and the blood vessels are being overworked. When you get high blood pressure, it's a sign that you're overworking your heart and your blood vessels. So untreated, the disease can lead to atherosclerosis and congestive heart failure. When you have hypertension for years, you end up with dementia, which is memory loss. You end up with an enlarged heart, blocked blood flow to the heart, and blocked blood flow in the carotid arteries, which leads to a stroke, kidney failure, aneurysms, blocked arteries, your sight goes, you can get hemorrhage into the brain. If you notice the blood vessel on this side here, there's a partial blockage of the artery as atherosclerosis takes place over time. I have a blood vessel here. Look at what the normal is compared to pre-hypertension compared to hypertension. Note, this is just a blood pressure between 120, top number between 120 and 140, and the bottom number between 70 and 80. That is pre-hypertension. You need to be at 140 for the top number, the systolic, to be at hypertension. And yet still, already at pre-hypertension, there's damage being done to your blood vessels. So it's not a joke when we say you need to keep your blood pressure at normal levels, because even at pre-hypertension, you're already getting damage done to your blood vessels. So let us look at left hypertrophic cardiomyopathy. If you look at this diagram here, the one on the left, you can see what is normal, the left ventricle, the muscle. Look at the gray part of the diagram, just out here. You can see the muscle is normal here. Over here, the muscles has become thickened and big, and that's because it has been put to work too hard. Remember the left ventricle, what it does, it pumps blood right around the rest of the body. And here you are with hypertension, forcing that left ventricle to work too hard. So you end up with breathlessness, chest pain, irregular heartbeat, lightheadedness, and fainting, all because you have hypertension. Coronary artery disease. Here you have a normal heart and artery, as you can see in the diagram here, and here you have the plaques growing on the walls. Plaques build up from excess sugar, excess fat in the diet, or just animal fats and oils in the diet. And there you go. You have a narrowed coronary artery that leads to a heart attack. So stroke and heart attack are very much alike. It's just that one happens in the brain and one happens in the heart. If a blood clot blocks blood flow to the brain, you end up with a stroke. Doesn't have to be a blood clot, it can also be the atherosclerosis, just happens over years. The plaque manages to finally block everything. And the heart attack knows the same thing. Either a blood clot or the plaque blocks the flow of blood to the heart muscle. This is the muscle now. And then you end up with a heart attack because the muscle does not get enough oxygen and part of it dies. Heart failure is very common in Jamaica. Jamaica is a very hypertensive society, so heart failure is very common. So here you have on the left, the heart muscle pumping blood out of the left ventricle. Now, as we showed before, that left ventricle that became too big, it becomes flabby. It's too weak that it can't pump anymore. And that is when you end up with heart failure. That weakened heart muscle over the years has lost its ability to pump blood out. And you end up with a backing up of the blood to all other parts of the body that it ought not to be in. So moving on now to the digestive system. The entire digestive tract is 30 feet long. Think about that. How tall are you? Most of us are just over 5 feet. And something 30 feet long is sitting in the middle of your abdomen. Your salivary glands can produce up to 1.5 liters of saliva each day. And stomach acid is so corrosive that it can dissolve wood and steel. Think about that. So what are the major organs of the digestive system? We have the mouth, the esophagus, the stomach, the liver, the pancreas, the small intestine, and finally the colon, which is called the large intestine. The function of the digestive system is to turn the food you eat into nutrients that the body needs for energy, growth, and repair, to absorb the nutrients, and then to get rid of the waste. So I have a question for you. Where does digestion begin? Nurse, can you facilitate that answering for me? I see Miss Hunter had her hand up first. Tell me, please, where does...
In the mouth, in the mouth.
Thank you. In the mouth. That is where digestion begins. Digestion of starches begins in the mouth. So it's so important to chew your food properly, people. Very important. Chew your food properly so it can mix completely with the saliva and digestion can begin properly. If you miss that part of digestion, your food will be all the more difficult to digest further down. Saliva helps you to chew, taste, and swallow. It prevents tooth decay, and it keeps the throat and mouth from drying out. It fights germs, and it prevents bad breath. Your saliva is very important. Saliva softens and transforms some of the starch into sugar. The longer the food is chewed, the more completely the starch is digested, and the larger the amount of gastric juice produced in the stomach in readiness to digest the food when it arrives. So the more you chew your food, the more your stomach is ready for it. And so the peristaltic waves are simply the waves that move the food down the digestive tract. Proper chewing and tasting of the food permits the nerves of taste to judge the quality of food and regulate the intake to suit the needs of the body. Proper chewing also helps to preserve the teeth by giving them the exercise they need. This is important. Food should not be washed down. Taken with meals, water diminishes the flow of saliva, and the colder the water, the greater the injury to the stomach. And that is Ellen White Counsels on Diet of Food, page 106. The benefit derived from food does not depend so much on the quantity eaten as on its thorough digestion, nor the gratification of taste so much on the amount of food swallowed as the length of time it remains in the mouth. Keep the food in your mouth and chew it properly. Counsels of Diet and Food, page 107. So the esophagus is that tube that connects from the back of your throat straight down to your stomach. It's 9 to 10 inches long. Look here, if you can see the esophagus here in this diagram, from your mouth, right at the back here, straight down to the stomach. After food is chewed, your tongue pushes the food into the back of your mouth where it goes into the esophagus. This is a muscular tube that connects the mouth to the stomach and it helps the food travel down to the stomach. The lower esophageal sphincter, that is important. It's at the end of your esophagus and it keeps food and digestive acid from flowing back from the stomach. You hear a lot of people talk about acid reflux. Acid reflux develops when the sphincter is not working properly. So here you have a diagram here showing you that sphincter when it is closed. No matter what is going on in the stomach, the acid won't come back up. But if the sphincter is open, then it allows for reflux, and then you'll get what they call GERD, which is so common. What weakens the lower esophageal sphincter? Excess weight, alcohol, carbonated beverages, caffeine, chocolate, fatty, spicy, and fried foods, highly acidic foods, peppermint, garlic, and onions. Careful how you ingest those. The stomach mixes and grinds food, and it excretes acid and enzymes that continue the breakdown of food. Remember, the food breakdown started before. Now the stomach is going to mix it and grind it and grind it and mix it so that the food can be properly broken down. The inner lining is made of mucus, which keeps the stomach from digesting itself. The average human adult can hold up to 8.5 cups of food in his stomach. Do not try it though. So an insight into the stomach was had by a man called William Dumont, who studied another man who had a gunshot wound into his chest wall cavity that allowed the stomach to be seen. So then they learned a lot about how the stomach works simply by looking through that little peephole to see how the stomach was working. And that man lived a very long time with that hole right there. So let us look at the physiological divisions of the stomach. The esophagus goes into the first part of the stomach, which is called where the cardiac area is, and the food enzymes worked here. And then the pyloric valve, where hydrochloric acid and pepsin work. And then at the bottom of the stomach, this is where liquid chyme, that's when all that all that grinding and mixing is taking place, everything forms into a liquid, and it accumulates at the bottom of the stomach before it goes into the duodenum. So let's talk about gastric juice. Gastric means it's coming from the stomach. Gastric juice contains mainly what? Enzymes that needs to break down what you eat, along with hydrochloric acid. So gastric juice is composed of mainly pepsin and hydrochloric acid. It also contains sodium, chloride, and potassium. So the gastric acid is between a pH of 1.5 to 3.5. If you notice, that is very acidic. So your stomach is quite acidic. So how is stomach acid made? Carbon dioxide and bicarbonate go through the parietal cells. It says parietal cells, so it's really parietal cells of the stomach, and they form carbonic acid. And carbonic acid dissociates and forms, let's have that hydrogen atom, which combines with chloride to form hydrochloric acid, which is your stomach acid. The hydrochloric acid takes 30 to 60 minutes to be made in the stomach. So after you eat, it takes 30 to 60 minutes for the hydrochloric acid to be eaten. Over the age of 40, it takes a little longer, 45 to 60 minutes. So gastric acid kills most of the bacteria that enter with the food. And the mucus produced by cells in the stomach to protect it from the corrosive effect of the hydrochloric acid. So if not enough mucus is produced, the hydrochloric acid causes the wall of the stomach to burn. So digestion takes time. The stomach takes in food, mixes it and grinds it up, churns it up, breaks it into tiny particles called chyme. This is done to mix the gastric juice with food. So after an hour or two, the chymes start to be released in small batches into the duodenum, into the small intestine. So it takes about 4 hours for this process to be complete. So protein digestion begins in the mouth. There are salivary enzymes that help to hydrolyze protein. Now, let us go to the duodenum. What happens in the duodenum? Carbohydrate digestion. Pancreatin amylase. Amylase, which is made by the pancreas, breaks down carbohydrates into maltose, lactose, and sucrose. And many complex carbohydrates contain raffinose and stachyose, and these are fiber that cannot be digested and cause a lot of gas formation. So that's why soaking before cooking is important, and garlic helps reduce the gas. Some people convert to a vegan diet and complain about the gas. It's because of these complex carbohydrates, raffinose and stachyose. Lipid digestion, lipid is fat. Chewing is important because lipase, the enzyme that breaks down fat, is made in the sublingual glands. So you have a salivary lipase along with supplemental enzymes that you can take, and gastric lipase, which hydrolyzes lipids 30 to 60 minutes until hydrochloric acid reduces the pH below 3. So it's important that decrease in pH forces a lot of these foods to break down. So lipid digestion also continues in the duodenum by bile. Bile is so important. Bile emulsifies fat and exposes the bonds of the fat so that the pancreatic lipase can act on it. If you do not break up the food with the bile, then the enzymes won't be able to act on it properly. The bonds, the necessary bonds for that chemical interaction won't be exposed. So supplemental lipase present will be reactivated, and the fatty acids which are released can now be absorbed through the intestine wall. Carbohydrate and fat is digested in the duodenum only in an alkaline environment. Notice we have changed. In the stomach, it was acid. Now, in the duodenum, it is alkaline that we need. It's an alkaline environment that we need. So how does the stomach go from, how do we go from an acid stomach to an alkaline duodenum? So you have in the blood carbon dioxide, and it combines with water to form carbonic acid, which dissociates to form bicarbonate. And bicarbonate combines with sodium, we get sodium bicarbonate, which is alkaline. So you have that sodium bicarbonate being formed inside the duodenum, that alkaline environment necessary for the lipids and the carbohydrates to be dissolved. The liver makes an enzyme called bile. We just talked about it. Bile is used to break down the fats, and the pancreas makes the enzymes that breaks down starches, protein, and fats. So let us talk about the small intestine a little more. It's a long continuous tube about 20 feet long and 1 inch in diameter. It's quite small, and there are many nutrients. In fact, most of the nutrients are absorbed in your small intestine. The large intestine, or the colon, is 5 to 6 feet long, and it is 3 inches, a little bit wider, and it absorbs water from waste, and that's where your stool is created, in the colon. So here we have an outline of the entire digestive system. The esophagus going into the stomach, going to the small intestine, that is all the 20 feet of it in here, and finally the large intestine to round out everything. So let's talk about the liver. The liver needs a lot to talk about because it's such a great worker. It's the greatest working organ in the human body. So the liver secretes bile that helps with fat absorption. It purifies the blood. It detoxifies chemicals and metabolizes drugs. It makes proteins needed for blood clotting. It stores excess sugar as glycogen. It stores vitamins and minerals, and it makes cholesterol. Everybody, all animals make their own cholesterol, and our cholesterol is made in the liver. The liver is such an important organ that we would survive only 1 or 2 days if it shuts down. If the liver fails, your body will fail too. You can live for years with heart failure, but only 2 days with complete liver failure. The liver is the only internal organ that can regenerate, so that's good. The liver can function even when 75% of it is diseased or removed by surgery. So you notice this very important organ, it's the only organ that can fix itself, it can regenerate, and it can function when most of it is absent. What is left can still function. Our poor liver can take a lot of damage before it starts complaining. And by the time you notice that it is bad, it's when you're severely hurt. So this is an example of a healthy liver compared to a fatty liver. When too much fat is stored in the liver, you see that change of shape, becomes soft to touch, becomes discolored, tough, fatty, and it can lead to irreversible liver damage, cirrhosis, and liver failure. And it mostly happens in people who are obese or who have type 2 diabetes. But There's also something called non-alcoholic fatty liver disease, which occurs in people who do not drink alcohol. We know that alcohol causes a lot of liver disease, but there are people who don't drink alcohol who also have a high chance of having liver disease. And these are the people with diabetes, who have had heart attack or stroke. So there are other liver disorders that are quite common and can worsen the state of the liver. Now, in non-alcoholic fatty liver disease, there's fibrosis, that's scar tissue forming within the liver. Now, cirrhosis is a serious condition where normal liver tissue is replaced by scar tissue, and the structure and the function of the liver are disrupted. And this is what leads to liver failure. There you have cirrhosis, normal liver on the left, cirrhosis on the right. The surface of the liver in cirrhosis is very nodular. When you touch a person on the outside of the abdomen, you can feel how tough the liver is and how nodular. And it can lead to the person's death because the liver eventually fails and stops working by the time which is such a state. Some liver cleansers: milk thistle seed, which helps the detoxification of poisons such as alcohol. It regenerates the liver tissue and stimulates bile production. Dandelion, which stimulates bile flow from the liver and is often used to help fatty liver, cirrhosis, estrogen dominance, and even acne. It's very good in women with polycystic ovarian syndrome. So here you have the pancreas, which produces all these enzymes that you need for digestion. Here's the pancreas right here. This one is almost shaped like a shoe, like a pointy shoe right here. It's in the back of the abdomen, and it's right close to the liver because the bile that's produced in the liver also goes down into the pancreatic ducts. So the gallbladder, oh my God, the gallbladder causes a lot of problems for people. It serves as a storage site for the bile that is made by the liver and is released into the small intestine when you need it. So it would be good if you don't lose your gallbladder. A lot of people lose their gallbladders by surgery. It would be good if you could keep it because it is important to release the bile, because bile is necessary for the breakdown of, everybody knows the we just said, fats. So gallstones are hardened deposits of digestive fluids. Sometimes we see the amount of gallstones people have, hundreds can be in that gallbladder. And they can be as tiny as a grain of sand or as large as a golf ball. Many are in between. Who's at risk? It's the F's, the fat female who's about 40 years old, and she tends to be in her fertile age, and she tends to be sedentary, have high cholesterol or low fiber diet, and a family history of gallstones. A lot of times people get into so much pain with these gallstones, they have to have the gallbladder removed, but it would be good to avoid these gallstones so you don't have to have that gallbladder removed, because bile is essential for your breakdown of fats. And when you don't have that breakdown of fats, what's going to happen to the healthy fats that your body needs to be digested? So let's go into the respiratory system. The average adult takes over 20,000 breaths per day. So can somebody tell me now what is the function of the respiratory system? What is the function of the respiratory system? Nurse, can you help me with opening up the mics? Ms. Walters has her hand raised. Go ahead.
That's your breathing system.
The respiratory system is our breathing system. Or what does the breathing system do for us? What does it help us to do? That's what I want to hear, Ms. Walters.
Well, if you can't breathe on your own, if you cannot breathe on your own, then they're going to put you on oxygen and you're going to have the artificial breathing. So it has to do with the breathing.
I heard somebody else in the background also say it.
Yes, I was saying that it's necessary for the waste, carbon dioxide to be removed from the body and receive oxygen.
Exactly. Two things were mentioned here. Get the oxygen, remove the carbon dioxide. That's all we need to know, right? Our respiratory system takes in oxygen and supplies it to the blood to be transported to the rest of the body. We saw in the diagram earlier where the lungs work along with the circulatory system to do that. And you need to expel carbon dioxide. Very important. Thank you. So those are the major functions of the respiratory system. So What are the major organs? It starts with the nose. If you don't have a nose, you won't breathe in your oxygen. Goes into your pharynx, goes onto your larynx, into your trachea, into your lungs, and finally into your diaphragm is at the base of the lungs and is an important part of your breathing mechanism. Here we have a diagram, your nose. The pharynx is where the nose goes down right behind the throat here. And then your larynx, which connects to your trachea. Here's the trachea right here, that tube that goes down into your chest. And then you have your bronchi, which go into your lungs. And inside the lungs, you have the bronchioles and the alveoli. We're going to learn all about these things right now. And of course, your very muscular diaphragm at the base of it all. So what happens when you breathe? When you breathe in, air is drawn in through the trachea and goes down into the bronchi, and your lungs expand. And all of the us have had to help our children make these balloons where it expand when you breathe in, the diaphragm moves down. And when you breathe out, the air is forced out through the windpipe and the lungs contract because the diaphragm has moved right back up. So let's talk about the alveoli. Alveoli are little sacs, they're round. They're at the end of the bronchioles. They're where the lungs exchange oxygen between and carbon dioxide. So oxygen moves in and carbon dioxide is moved out. So that's where the lungs exchange carbon dioxide and oxygen. Now, what happens in asthma? If you look, there's a normal area. That's how wide the area should be. Now, an asthmatic has a contraction of that wall, of that muscular wall, and the one wall becomes inflamed and thickened. And it's, even when an asthmatic is not having an attack, you can listen to them and you don't realize that they're asthmatic, because you can hear the difference between the airflow between a normal airway and an asthmatic airway. And then God help us, when they're having an asthmatic attack, they become so constricted that you begin to hear whistling sounds of the air trapped in the alveoli and unable to get out. Asthmatics don't have a problem breathing in most time, but they have a problem with breathing out that air that is trapped inside the airways. And it is a very uncomfortable thing that they go through, as all that tight and smooth muscles, okay? So how tobacco affects the lungs? They destroy those alveoli. If you look here, you see some enlarged alveoli who have lost their walls, there are fewer capillaries there. Smoking damages the airways and it damages the alveoli. So they can't have any proper exchange of air. So they're forever short of breath. They always have low oxygen levels. And there's a lot of mucus in the bronchioles that block off proper airway flow. Let us go into the nervous system now. The human brain contains 100 billion nerve cells. This wonderful eye that God gave us can distinguish up to 1 million colors. And the nose can identify and the brain remember more than 50,000 smells. Isn't God marvelous? So the major functions of the nervous system is collect sensory input from the body and the environment, process this information, interpret it, and then respond appropriately. The major organs of our nervous system is our brain, that all-important brain, our spinal cord, our nerves, and our sensory organs. What are our sensory organs? Our eyes, our nose, our ears, our tongue, and our skin. Now, the central nervous system, the center of it all is the brain and the spinal cord. Now, the peripheral nervous system, peripheral means that's what's on the outskirts, what's around on the edges. So the peripheral nervous system is divided into voluntary and involuntary. So voluntary is the nerves that connect the brain and the spinal cord to the muscles and the skin. The involuntary, the ones that regulate the process that we don't do with conscious effort, such as blood pressure and breathing rate. That is our autonomic or involuntary nervous system. And voluntary is a movement, the one that makes us move and do things. That is our somatic or voluntary nervous system. The brain is like a computer that controls the body's functions. The spinal cord runs down the inside of the spinal column and connects the brains with the nerves going to the rest of the body. The basic cells of the nervous system are neurons, and the brain has over 100 billion neurons. These are just little cells in the brain. These parts of the brain. Now, it's very important. Our cerebrum is the largest part of our brain. It controls thinking, speech, emotions, and it has 4 main lobes, while the cerebellum coordinates movement, and the brainstem does the things, the automatic functions or autonomic functions that we do without thinking: heartbeat, breathing, swallowing. Look at the brain. This yellow one here, that's the frontal lobe. It does the problem solving, the creative thinking. It determines our personality. If you have frontal lobe damage, you have a damaged personality. The parietal lobe on top here, it controls visual function, reading and understanding language. The occipital lobe, the green one, vision. The temporal lobe, that's just above our ears right here, that controls memories. The cerebellum, balance, coordination, and motor learning. If your cerebellum is damaged, you cannot walk in a balanced fashion. And your brainstem, if your brainstem is damaged, your basic life functions are in jeopardy. Okay? So the neurons talk to each other through complex electrical and chemical processes. We see the parts of the neuron, the dendrites and the axon, the long stem here, allows the neurons to communicate with each other. So God is so great, even the little cells can communicate with each other. So a nerve impulse is a signal transmitted along a nerve fiber. The speed of a nerve impulse depends on the nerve involved, but messages in the brain can travel at speeds of 268 miles per hour. Anybody ever drive at that speed yet? I doubt it. But that is the speed at which a message is traveling in your brain. And foods that help speed up this nerve function is flax seeds, walnuts, avocado, vitamin C, and vitamin D. So neurotransmitters are chemicals that aid the transfer of nerve impulses from one nerve cell to another. And our neurotransmitters are so important because they regulate a lot. Serotonin regulates the amount of food you eat. It regulates your mood, your sleep. Dopamine regulates your movement and allows you to experience pleasure. Endorphins moderate pain. And glutamate is the most common neurotransmitter in the brain. It monitors taste and sensation. Now let's go into some pathology again. Sciatica. A lot of people have sciatica because it's caused by obesity and heavy lifting. That's almost more than half the population. Someone is going to lift something heavy one day. So usually it starts when the discs herniates in the lower spine. Now the discs are simply the small sponges between the vertebrae, the bones. The bones have these discs between them. And the herniated discs put pressures on the nerves around it, and you end up with this pain running down the leg, running down the sciatic nerve. You can see the sciatic nerve running straight down the leg here. And then you have the pain running down that entire lower limb, the thigh, into the leg, straight into the feet. Now let's go into our muscular system. What is the major function of our muscular system? To allow you to move. It's responsible for the voluntary and involuntary movements of the body. It stabilizes the joints and it maintains posture. Without your muscles, you will have no posture at all. Without the muscles, your joints won't be able to move. So the muscles can be skeletal, which are used to move bones, and they're voluntary. You can have smooth muscles, those are in the internal organs like the lung and the blood vessels. And you have cardiac muscles, which is found in the heart. Now, sarcopenia is something that happens when people lose muscle when they age. It begins as early as in your 30s. A lot of us are already in trouble. And in physically inactive people, you have 3 to 5% muscle loss every single decade. You're losing your muscles if you're physically inactive. Our skeletal system, we're referring to what? Our bones. When a baby is born, it has 350 bones. But guess what? An adult has only 206. How come? Because the bones fuse together during growth. All right, and we end up with less bones than we started out with. So the major function of the skeletal system supports the body, aids movement, The skeletal system, especially the skull, protects the internal organs and produces blood cells. A lot of our blood cells are produced in our bone marrow. So the bones have very important function. So what are the major organs of the skeletal system? The bones, the tendons, the ligaments, and the teeth. The tendons attach bone to muscle, and the ligaments attach muscle to muscle. Okay, so here we talk about sciatica before, and here we have the vertebral column. There are 33 small bones in the vertebrae. Here you have them outlined: 7 cervical, 12 thoracic, lumbar here in yellow, 5 of them, and the sacrum, 5 of them in the green here, and the coccyx has 4 fused bones. So there you go, the 33 bones that make up your vertebral column are what we call your spinal column. Those are the bones that we're talking about, allow you to maintain your posture also. And the discs that we mentioned in sciatica, the discs that slip out of place. Here we go, the discs are blue here. The discs are shock absorbers and any flexibility. You'll not be able to bend over properly if you didn't have this flexible disc allowing the spinal column to move. So here you have a normal disc, and sometimes the disc can start to bulge, or they can push completely back in onto the nerve. They degenerate in arthritis, and they become broken, or they become thin, and that is the pathology of the discs. Now here's a normal disc over here. You see the front, you see the back view. At the back in the yellow, that is our spinal nerve root. And of course, as you see in the disc in blue here, the disc slip out of place, it presses on that nerve. If it is above the lumbar spine 1, that nerve that you're pressing on, it can lead to your paralysis. You won't be able to walk if you have a disc pressing on those nerves. So it's important to keep your discs healthy and in place. Avoid being overweight. Be careful of how you lift heavy objects. Long bones contain bone marrow, which we said before, where blood cells are produced. A merry heart doeth good night medicine, but a broken spirit dries the bones. So if you drop your bones, you won't have any blood cells. That's from Proverbs 17, verse 22. Let us look here. We said before, look at the ligaments connecting bone to bone. Here we have many ligaments. They're in the gray. Ligaments connect bone to bone. Here we have an example. Can anybody tell me which joint we're looking at? I want somebody to just tell me which joint it is that we're looking at. Anybody? Any takers? Sandra, Miss Walters. Go ahead.
The truth.
All right. Anybody else?
Knee
The
bone.
esophagus.
Knee.
The knee.
The knee.
Very good. Somebody got it. The knee. We're looking at the knee bone. Here we have the bone that's running down our thigh. That's called the femur, right? And then above, just, you see, anytime you see the patella, you know we're dealing with the knee, because the patella is what they call the knee bone. That little bone that you can feel on top of your knee, this right here is the patella. And then you have the 2 bones in your legs, one called the tibia, one called the fibula. Now, notice this white part is called the meniscus. The meniscus is a shock absorber. So when you walk, it absorbs the shock on your body. Now, over time, this meniscus can become damaged and you end up with arthritis. One thing you can end up with is tendonitis. I said the tendons connect the muscle to the bone. And with repetitive movements, you end up with an inflammation of the tendons, and those tendons can even tear sometimes. So you and they are a very painful condition if you suddenly start with new activities and or sudden strain on them. So here we have arthritis of the joint. So this is a healthy knee where the cartilage is normal. And notice the osteoarthritic knee, no cartilage is there. It's completely eroded, and you have bone rubbing on bone, and how painful that is because there's nothing there to absorb the shock. Look at this x-ray, the normal x-ray, and then when you look here, the arthritic x-ray, you have the bone touching the bone. The cartilage has disappeared, and you just have bone rubbing on bone, which is very painful. Bursae are small fluid-filled sacs that are located at points of friction around joints and between tendons, ligaments, and bones, and they can become very inflamed. Osteoporosis. We talk a lot about osteoporosis. This is a normal bone. A normal bone has the holes in there normally, but look at the size of the holes in someone who has osteoporosis because they lack calcium. Sometimes people say they want to drink the cow's milk for calcium, but I always say, what did the cow drink? What did the cow eat to get this calcium? The greens or green vegetables are full of calcium. And in an acidic body, the calcium is likely to leach, to be sucked out of the bone to combat that acidic body you have when you eat a lot of meat products and animal products. So it makes no sense you eat those things trying to build a bone when it's just leached back out. Get your calcium from your greens and strengthen your bones with walking. Now let's go into the female reproductive system. Function of the female reproductive system: produce eggs, protect and nourish the offspring until birth, and nourish the infant after birth. Now, the female organs: vagina, cervix, uterus, fallopian tube, ovaries, and breasts. Now, look at this diagram here. Here you have an ovary, and then we go straight here into the fallopian tubes, which are connected to the uterus. This whole thing here is a uterus. See, both sides you have fallopian tube, and you end up back in the ovary again. And here you have the cervix. The cervix is the neck of the womb, which is at the end of the vagina here, which is this muscular tube, the vagina. So here you have the female reproductive system, except the breast. Now, uterine fibroids form in a lot of women, and it has been mainly linked to high sugar and high animal product diets. So you have different types of fibroids. They cause bleeding, they cause a lot of pain. Some of them are pedunculated, hanging out of the abdomen, some hanging into the cavity of the uterus itself and cause fertility problems. You have the submucosal ones that are just under the lining of the uterus, the subserosa, which are on the outer wall, and the ones that are right in the intramuscular area, which are the ones that are so painful when the uterus has to contract during the period. Now, the male reproductive system has the function to produce, nourish, and transport sperm and its protective fluid, which is semen, discharge the sperm into the female reproductive tract, and produce sex hormones. So it is the testicles, the penis, and the prostate. A lot of men, oh gosh, it's so common in Jamaica, have what they call prostatic hypertrophy. That's when the prostate becomes too big. Every year that a man lives, his prostate becomes bigger and bigger. So you have the normal prostate there. And if you notice that this is your bladder, and then this is the prostate just below the bladder. Now, when the urine is in the bladder, notice the urethra in the normal prostate, how big it is. There's space for the urine to come out. Now, when a man has BPH or prostate cancer, the prostate becomes so large that the urethra, that's the tube, becomes very thin, and sometimes it's completely blocked off, and the man is unable to urinate properly. Sometimes they're just dribbling. They don't know what a proper urination is anymore. They're just always dribbling. And we know what protects it, the diet. So the urinary system now consists of the kidneys, the ureters, and the bladder, and has a function to remove waste, control the body's fluid balance, and maintain normal electrolyte levels. So the major organs are the kidneys and the bladder, with the ureter and the urethra. The ureter connects kidney to bladder. Here we go, the ureter is inside the abdomen. It connects the kidney to the bladder. Bladder is where the urine is stored until you're ready to let it out, and which is controlled by a sphincter. If you didn't have that sphincter, you wouldn't be able to decide when your urine leaves your body. It would just go out whether or not you like it. And then the urethra now connects the bladder to your outside. The kidney, very important organ. It acts as a filter. Blood is filtered and waste is removed. Blood enters the body into the kidney, it is filtered, the waste is sent in the urine to the bladder, and the filtered blood is returned to the body to go back to the heart to be pumped all around again. The kidneys release some very important hormones. It makes the active form of vitamin D. When you absorb vitamin D, the sunlight is not vitamin D in the active form as yet. It has to go to the kidneys to be converted. Renin, which regulates blood pressure. A lot of blood pressure medications are aimed at controlling renin. And erythropoietin, which stimulates red blood cell production. Anybody whose kidney is not working end up with anemia because of this. Erythropoietin is not be able to work. And here you have some kidney stones here. Some, they form at different levels. Some form up here in the calyx. Some form what they call the pelvis of the kidney, and some form the ureter, form right here in the tube that is going to go to the bladder. And these are so painful because they have a block of all the urine that's leaving the kidneys is blocked up, and the kidneys swell and soon stop working. So that's what kidney stones can do. Let's look at our lymphatic system. It is one organ system that everything is scattered all around the place. It isn't like some organ systems that are grouped together. The major function is to protect from anything that isn't you. Bacteria, viruses, cancer cells, whatever that your body says, oh, this is not Simone. Let me see what it is that's coming in. It is going to protect you. So the major organs of the lymphatic system, the tonsils and adenoids. Sometimes they remove the kids' tonsils. They need them. They are part of their lymphatic system. The lymph nodes are lymphatic vessels, the thymus. Lymph nodes underneath the arms, the axillary lymph nodes, the spleen, where a lot of the lymphatic cells are made, the Peyer's patch in the abdomen, the appendix, another thing that's often removed when it's inflamed, because well, you'll die if it remains in there. But they say it has no purpose, but no, the nodes are part of the lymphatic system. Your bone marrow, where a lot of lymphatic cells are made, and of course your lymph nodes in your groin. So the tonsils, the bone marrow, which makes white blood cells, the lymph nodes, which filters and traps viruses and bacteria, the spleen, which filters blood and white blood cells, and the digestive system, up to 70% of the immune system. So I notice that some hands are raised, but if you have any questions, I'll take them at the end, so we don't lose the flow of what we're talking about. The digestive system, which has up to 70% of the immune cells, are in the digestive tract. How important it is to keep your digestive system healthy. So the lymphocytes, during COVID especially, we heard a lot about our immune system, and this is what they're talking about, the B cell lymphocyte, which creates antibodies. And antibodies are just these little things that go and mark an invader for destruction. And then the T cell lymphocytes will come and destroy whatever the antibody has marked. Now, bacteria, viruses, and fungi of the digestive tract are an important part of the immune system. These organisms outnumber the cells of the body. Low diversity of gut bacteria is related to obesity, diabetes, cancer, and irritable bowel syndrome. So changes on a day-to-day basis depending on the diet. A lot of our prebiotics that we need are found in our green vegetables and our vegetables. So if you have a diet without vegetables, then you're going to have a poor gut microbiome. Autoimmune disease is when the immune system attacks healthy cells. So there are common autoimmune diseases. These are when you have these parts of the body being attacked. The rheumatoid arthritis is a part of the body that's being attacked, is the joints. In lupus, it's the joints, the skin, the kidneys, the heart, and lungs. In inflammatory bowel disease, is Crohn's, ulcerative colitis. Type 1 diabetes is the pancreas that has been destroyed. A lot of little kids, they found that when they were fed cow's milk as babies, they destroyed their pancreatic cells and they developed type 1 diabetes. Graves' disease and Hashimoto's disease, their thyroid was attacked. And when you have alopecia areata, their scalp cells that were attacked by the immune system of your own body. So the lymphatic system functions parallel to the circulatory system, but it has no pump. How does the lymph move around the body? When you move, walking, rebounding, when you drink warm water, when you do a lymphatic massage. So our integumentary system is here now, and the skin is the largest organ of the human body. It regenerates itself every 27 days. So the average head has 100,000 hair follicles, each capable of producing 20 hairs during a person's lifetime. So the major function of this outer layer of our body with integumentary system is to protect the body, waterproof the body, prevent fluid loss, block the entrance of pathogens into the body, allow us to have a sense of touch, and help us manufacture vitamin D while screening out the harmful ultraviolet radiation from the sun. So the major organ of integumentary system is the skin, the hair, and the nails. So the epidermis makes your waterproof melanin production. That's why some people can bleach, because the epidermis, that outer layer that you see here, the top layer is the epidermis. And that is where our melanocytes are stored, right on the edge of the epidermis there. So when you rub something on the skin, you can actually bleach the skin because it's the outer layer that is where the pigment cells are. The dermis, it contains nerves that sense temperature, pressure, pain, and it produces oil that keeps the skin soft. And that's where the hair starts to grow from. The hair follicles start in the dermis there. Sometimes I see people tattoos and they ask, wasn't it painful? They say no. And I say, how come that? Then I realized that a lot of the nerve cells are located in the dermis, while the tattoo is going on the epidermis, destroying the epidermis, but they don't feel the pain of that destruction. The hypodermis protects you from heat and cold. Your sweat glands start off in your dermis also, and your blood vessels are below the dermis in the fat layer. Let us go to our endocrine system, a very important system. It involves the pineal gland, the pituitary gland, those are two that are in the brain, the thyroid gland in your neck, the thymus, which is mostly in children, but is in your chest, the adrenal gland and the pancreas are in your abdomen. The adrenal glands are these little kidney caps, they're on top of the kidneys. Your ovaries and your testes are all a part of your endocrine system. The function of the endocrine system is to produce hormones that regulate metabolism, growth, development, sexual function, reproduction, and sleep. Now, let us look at these glands. Pineal gland, it produces melatonin, which is important for sleep. The thyroid produces thyroid hormones, which if those are out of whack, your whole metabolism, your heat system, your cold system, whether or not you get fat, whether or not you lose weight, a lot is regulated by your thyroid. Here, in your hair growth. Adrenal glands produce cortisol, which is our stress response. So I have adrenaline. It comes out of the adrenal glands. Pancreas, that makes insulin and controls sugar. Ovaries that make estrogen, and the testicles that make testosterone. The estrogen is responsible for your female traits and the testosterone for your male traits. So for you form my inward parts, you knitted me together in my mother's womb. I praise you, for I am fearfully and wonderfully made. We're going back to Psalm 139, 13 to 14. We're at the end of our presentation. May the grace of the Lord be with you all. And nurse, I'm going to ask you to help us right now to take any questions that are there. Nurse, do we have any questions? I saw some hands going up. I see 3 participants have raised their hands. I am unsure. Okay, so Dorothy Simmons, go ahead with your question.
I'm going to ask Dr. Lambert to just stop the sharing. Thank you so much.
Dorothy?
And you can wrap up. Dr. Lambert, can you stop the sharing, please? And
Not hearing anybody talking.
All right. So students, we're not going to take any hands this evening. We're going to just close because it's very late. Just write down your questions and we will address them another time. All right. Is on? All right, Sister Sonia, I see your mic is. Hello, can anybody hear me?
Mute.
I'm hearing you now, Sister Sonia. Yes, please go ahead.
I must have had my hand up for a long time. I didn't really want. You want me to close for you?
I just want you to pray and close. Yes, because it's running until late.
Okay. Father, Lord in heaven, we humble come before you at this time, dear Lord, thanking you and praising you and lifting your name up on high. Thank you for allowing us to go through the class tonight, dear Lord. Even though we had so much glitches, dear Lord, you were able to bring it to completion. And now as we are going to take the shape of death upon our bodies, I pray that thou will be with us through the night and be thy will. Bless us all to live to see another day. Thanking you for loving us. Thank you for caring for us. Thank you for dying for us. Forgive us all of our sins. In the precious name of Jesus Christ of Nazareth, with thanksgiving, to God be the glory. Amen and amen. Good night, everyone.
Thank you so much and good night, everybody. See you tomorrow at 5. Bye.
Bye.